It is my pleasure to introduce to you Lynette Hickey.
Thank you. I appreciate that. One of the things I failed to leave off on my resume is I'm also the mother of a 17-year-old son. So I have endured some of the fun things that we did endure as parents and have the challenges that you face as well. My son does suffer from mild levels of anxiety. I won't say that it's in remission, but as we have gone through the years of school, we have addressed ways to manage that emotional regulation that comes along with anxiety. And it does require quite a bit of parental involvement, even though they don't want it. It's just figuring out how to give it without them feeling like we're parenting them. And then my son will tell me, don't social work me. So I get the double whammy of that. I'm not one of your patients, he'll retort back. So I have to remind myself sometimes to step back and just try to figure out what's the best way to approach things for him. The thing is everyone at one point in their life or another will have some experience of anxiety. It is one of the few disorders out there that actually touches all levels of the population and all ages of the population. Not everybody, depression will as well, but anxiety, because it's a normal part of life and dealing with stress, they tend to feel that it definitely crosses all boundaries. Now, how each age group kind of addresses that or experiences that is different. So how I experience my anxiety might be different than my son experiencing his anxiety, or my father experiencing his anxiety as he grows older. Because once again, that kind of goes along with our life stressors and what we're doing. My stress is different than my son's stress because of the events going on. My stress is different than my father's stress of the events going on. So you do have age-related issues when you are dealing with stress and anxiety. Some of the things that we find, though, is anxiety and stress can also be very motivating. We've got a big test coming up. We have public speaking coming up. And as each of those will come up, we find that we feel this building up in us. Some people are very good about managing it and other people aren't. But a lot of that comes along with what we've learned and what we've witnessed in our life and how we've been taught to manage it. You'll hear words like emotional dysregulation. Big word. All it means is difficulty managing my emotions at that point in time, okay? You have to be careful that somebody's not just going to throw a bunch of big words at you and talk with you and not at you when you are looking to either seek help or to gather information. You want that more conversational style when dealing with anxiety. Because one of the things that comes along with anxiety is racing thoughts. And as we have racing thoughts, it's really hard to focus, right? And concentrate. So we really need clear, simple guidance. And that's what I'm hoping to give you tonight. It's just some clear, simple guidance, some symptoms that go along with some different types of anxiety that the adolescents and teens may experience or you may experience. As I said, anxiety is a normal part of life, so sometimes it's always in the background, kind of like that little buzzing noise, but you just kind of ignore it and you move through it. There's other people, though, who when they experience anxiety, it's almost like this intense buzzing in their ear, and that they can't even get it to go away. It's no longer in the background, it becomes in the foreground. And once anxiety has hit that foreground for us, rather than being in the background, that's when we are going to see a lot more symptomology come out of it. A lot more complaints from a lot of different areas, physical, mental, sometimes spiritual. As teenagers are dealing with anxiety, we have to, as parents, we need to kind of see is there anxiety remaining in that buzzing in the background, or is it moving to the foreground? And are we paying attention to those signs and symptoms? Sometimes, as we get busy with life, we tend to kind of try to push things off, and I think sometimes we don't always catch all the signals that sometimes the teenagers give off, because life gets busy. We've got extracurricular activities, we've got both parents working, we've got a lot of other anxiety and stress. Heck, that last year we had COVID, a year and a half we've been dealing with masks, social learning, in-person learning now. You know, as the kids just got used to remote learning, we're like, okay, no, we're going to do hybrid learning. Nope, you could be exposed, so now you're going to go back. You know, there's been lots of back and forth. So there's been a lot more external stressors happening to the family. And this impacts every member of the family. As we go on, we look at the different types of anxiety disorders there are. I'm going to go through about 6 main ones for you. The first one being generalized anxiety disorder. This is more characterized as just a general worry that could include past, present, or future. So right now in my house, what is it? College. Future worry. Where are we going? What are we doing with our life? I don't know. And it's hard to sit back and watch the I don't knows. So I'm sure he feels the tension coming from me sometimes, and I'm like, okay, back off, he doesn't know yet. But we have to learn how to balance that. So as some child, teenager might be experiencing generalized anxiety disorder, they are going to be having worries about events, worries about what might be coming up. They may even be worried about world events. A true generalized anxiety disorder, though, will not be diagnosed till they've experienced this for 6 months or more. There's usually not a huge amount of physiological or physical effects that go with generalized anxiety disorder. They might develop the little bouncing of the knee, or, twisting of the hair, maybe picking or a little rubbing, but it's not like those physical symptoms, which I'll go through, which happen during a panic disorder. I'll go through those in a little bit. A panic disorder is more so related to a teenager who is having constant panic attacks. And they're even having panic attacks about having a panic attack. It becomes very secular. It goes round and round and round. And this is where you're going to start seeing that fear of even doing things. When you're crossing that panic disorder realm, they're not going to want to do activities. They may even not want to go to school. They may not want to even hang out with their friends, do things that they normally do, because they're afraid that they might have a panic attack. The thing with undiagnosed panic attacks or untreated panic attacks and panic disorder can actually turn into a fairly serious disorder of agoraphobia, the fear of leaving the house. So once again, it's something that we want to treat because we do not want the teenager to develop that fear of leaving the house. I look at a lot of people right now who still struggle with leaving the house post-COVID. We've got used to having grocery delivery and everything that on our whim to be delivered to our home. Why do we need to go out? So people who had tendencies for agoraphobia, all that did was feed that even more so. And we are seeing a lot more of agoraphobia in not just adults, but teenagers as well. Separation anxiety, another type of anxiety disorder, of course, where they're afraid to leave home and be away from you or someone else that they see is important in their life, and when they're away from you, they feel this complete and utter helplessness. Teenagers can feel this. I know we think of younger people, littler ones, with the separation anxiety, first day of kindergarten, first grade, but teenagers will have this as well. They're not going to verbalize it though, like a kid will, a little one will. The little ones will more so tell you, I don't want to be away from you. Teenagers usually do not verbalize that. We have to read the signs that kind of go along with that. Are they okay when you leave the house? Can they stay home alone? Those types of behaviors. Or do they need to know where you're at or what's going on at all times? They're not going to tell you, Mom, don't leave the house because I'm afraid to be alone. I'm afraid something might happen to you while you're gone. So we have to pay attention to the words, too, that are coming along with it. Then there's just general social phobia, where they're more so afraid of looking dumb or inadequate in front of other people in social situations, whether it's school dances, sports, different things like that. They may have been a big sports person in grade school, and then in high school, they feel like they're not good enough to make the team or even try out. A lot of that may become a social phobia that we have to be aware of. And then there's just general specific phobias that they will tell you what the phobia is, and their response will feel very much like an overreaction to you. I'm afraid to go to restaurants. Why are you afraid to go to restaurants? I just don't like restaurants. Okay, it just doesn't connect for you. It makes no logical sense. And that's the thing with phobias. There's tons of logic going on in their brain, but to our brains, when they're telling us that, we're like, it's okay. Even going out in the rain or thunderstorm or different things like that. If they've been in a car accident when it's been raining, guess what? Sometimes you'll develop a phobia about driving in the rain. And then they'll be like, can you pick me up from the game instead? Why don't you just take the car? Go drive yourself, be okay. And then we'll have an overreaction to that. They will not understand how to process that with you. And they'll be like, no, please just take me, please just pick me up. It probably is because of something they've developed because of the brain. So even minor fender benders or different things like that can cause a certain level of anxiety within somebody and cause a level of phobia. The thing with anxiety disorders, they are highly treatable. Some doctors will choose to use medications, but usually a type of either cognitive behavioral therapy or dialectical behavioral therapy, so big words again, CBT or DBT, will help you to help them. And that involves a clinician. CBT, basically, we talk with the person and kind of discuss how our thoughts directly impact our feelings, which then directly impact our behavior. Dialectical behavior therapy, or DBT, we will basically help them figure out how to process that uncomfortable feeling they're feeling and having. And from a physiological standpoint, we will talk to them about how to deal with distress, how to deal with the uncomfortableness that they're feeling. They do, a national survey actually has reported that they feel that 8% of adolescents actually, between the ages of 13 and 18, have an anxiety disorder. When you break that out, that's 1 in 8 have an anxiety disorder of some kind. There are certain causes and factors for anxiety. Some common causes, of course, are genetic, just like everything else. If we have what we call a first generation or first degree type of connection, where a parent or maybe even a grandparent suffers from anxiety disorder, the prevalence runs higher. Environmental. There are so many environmental stressors out there that can cause anxiety disorders or lead to anxiety disorders. Of course, there's stressful events, of course, such as death of a loved one, moving to a new area, divorce, changing of schools, anything that the teenager or person has deemed as stressful can lead to this. The other thing, though, is sometimes the fear becomes so much, I think, and I'm going to go back to COVID, I think a lot of times people were like, oh, we can't leave our house. We can't leave our house. And we put that on to our children. We can't go without a mask. We can't do this. We can't do that. We did a lot of can'ts the last year and a half because of the laws and because of mandates and everything else that was going on. Well, as a kid is hearing that, even when we're not talking to them, we have to remember they're always listening. They're hearing us. They're hearing our worries. They're hearing our fears. They're hearing our complaints. And then they take that in and then they process it themselves. And then, they begin to worry that things might be a dangerous place to live. Going downtown Chicago. I live in Chicago, but going downtown, you're hearing about all these things on the Mag Mile and everything else. And as a parent, do we want our kids to go down there alone? No. So then we're like, you can't do that. Do we know anything would actually happen to them? No, but we have to do what we feel is right. But as we relay our fears to them, they hear. We don't think they always hear because they pretend they don't, but they do. They actually are always hearing and listening. It's just what they choose to do with it. But when we put that on them, we really do begin to see how that can impact them. Okay? There are some risk factors for anxiety disorders. Being female is one of the highest. Female over males have more anxiety disorders. Any traumatic events that happen during childhood, stress due to a chronic illness of the child or someone they're close to, parent or grandparent usually. And then drug and alcohol use. Those are all risk factors. And actually with drug and alcohol use, that comes sometimes out of self-medication to manage the anxiety. I can't tell you how many people tell me they use marijuana to quell their own anxiety, to sleep at night so the thoughts don't bother them. And that's not just adults, that's the kids coming in telling us too on the unit. It may have started simply as a test at a party or different things like that, but the daily use comes out of usually some need to self-medicate, to feel better. And whether it's depression or anxiety, doesn't all matter. They're self-medicating. We need to get them treatment. I said I was going to go through some symptoms. Generalized anxiety symptoms as more of a restlessness, feeling kind of keyed up, easily fatigued, difficulty concentrating, irritability, my neck hurts, muscle tension, headaches, and then sleep disturbances. Panic disorder is where you're going to have those physical ones. You're going to have that chest pain, the beating heart, tachycardia. You may feel like you've been choking, like they'll tell you they're having trouble swallowing, I'm having trouble breathing. They're feeling things close up. There is a sweating, trembling, upset stomach, sometimes vomiting, dizziness, sometimes even a numbness. They'll kind of almost tell you that they feel like they're having an out-of-body experience. We call that derealization, where they're kind of feeling like they're separating. They also will tell you they feel like they're going crazy. Because when you're having that physiological response, you do feel like you're dying. General anxiety is worry. Panic is you feel like you're going to die at this moment, right now. Your heart is going to beat through your chest. So that's a big difference for the panic disorder versus the generalized anxiety disorder is that physiological component that comes along with it. The social phobias are more so that avoidance, finding reasons or excuses not to go, not to do things. Sometimes they'll even feign an illness to not go, even if they don't have one. And then when they're doing the specific phobias, it's once again avoidance of the distress, difficulties in school or family functions. They might actually not just have the dizziness, but have syncopal episodes where they faint because they've just elevated their blood pressure so much that they just kind of pass out for a moment and get really lightheaded and lose consciousness. And then they will always complain of the sweaty palms with the phobias. They usually are just, they can be in a cold ice and they'll tell you their palms are sweaty. So, as parents, how do we respond to that? Well, hopefully we've done our job as best as we can and as best as they allow us, but they feel like they can talk to us. I will tell you, sometimes the answer is still no. They won't talk to you. No matter how close a relationship we have with them, they still will choose not to talk to you. We have to tell them, that's okay, you're not ready to talk right now, but please know that I'm going to check back with you in an hour. I'm going to check back with you. So I want to kind of do those simple check-ins with him. And I find that goes better because sometimes they've got to even kind of wrap their head around what's going on before they're ready to even talk to me. So I usually will give hour time frames and I'll be like, that's okay, why don't you go do what you want to do for a little bit, but I'm going to check with you in about an hour and see how you're doing. Just check in. I think when we can take it lighter with them and not be so intense and so parental, it will usually have a better response overall. Some kids, if it's not you, then you say, if you can't talk to me, who do you feel comfortable talking to? We don't take it personal. We have to be careful not to take it personal when they'd rather talk to somebody else. If it's a school counselor, a coach, whatever, whoever, we want to encourage that. We want them to reach out to whoever they're willing to talk to. And sometimes it may be their friends, and that's okay too. Because sometimes the friends can help diminish the anxiety because they're going through it too. Oh man, don't worry about that, that's okay. We'll get through it. The teacher will talk us through it or whatever their anxiety is about, or coach will help us figure that out. So we want to offer that help and feedback, but we also want to be allowed to help them find somebody else to talk to if it's not us. If it is us, we want to kind of trace their anxiety back. We want to try to get as much information as we can. So we ask them, well, what does it feel like? I know what it feels like when I have stress. What does it feel like for you? And try to figure out what they're experiencing. So that way we have a better idea. Okay, is this maybe just a generalized anxiety, or is this just normal anxiety? Or are we moving into panic disorder? What's happening? So as we do that, we have that open conversation working with them. It's okay to tell them sometimes about what you've done to manage your anxiety, or your stress. I will tell you though, telling them you just got to work through it is really, they will shut down and quit talking to us as parents because they don't necessarily want to hear that. I know it's hard as parents to try to figure out what the right way is to manage things and to help our children the best we can. And it's hard not to tell them do what I say. But the more we can advance our relationship with them and try to create that open conversation, the better we have the ability to help them. We need to remind them of the resources out there. The schools have lots of resources. You're going to be learning about that today. You're going to be learning about community resources. You're going to be learning about a lot of different things today. I will tell you, though, the one thing that we have to be careful is that they start using the words suicidal. And we think, it's just anxiety. Why are they suicidal? It's not just depression that has suicidal tendencies. Anxiety does as well. Because why? It is a very uncomfortable illness. There are those physical symptoms that go along with it. There's that lack of sleep. If anybody goes without sleep, good sleep, good refreshing sleep for any period of time, they can become psychotic. Even a regular average person, if you put them on 2 hours of sleep all the time, because they're worried about this or they're worried about that and their thoughts are not shutting down, you can become psychotic. You can become suicidal. And those are the things that anxiety does. It robs us of our sleep. It creates racing thoughts, and it is physically uncomfortable. And when we don't know how to manage that, we have to seek treatment immediately. The nice thing about Silver Oaks, we have 24-hour assessment, guys. You can walk through our doors. If you walk through Silver Cross's doors, we have staff in Silver Cross's ER as well that can assess your child. Go through and help you to ascertain what might be the best level of care for them, whether that's inpatient, outpatient, or referrals. As parents, we have to be very proactive, especially when we start hearing those trigger words, like suicidality. Sometimes you will have a child who will start to self-injure, cut. That usually, the first time will entertain a inpatient stay as well. Cutting doesn't always mean they want to die, though. And that's for us as the professionals to try to figure out, too. Is the cutting a self-relief method, or is it a method to help them kill themselves? And that's why we have to be involved with that as well, their self-injury starting, because it's one precursor leads to another. There's a lot of resources out here. There's a lot of good therapists out here in our community. I think we can do a lot of good to help our kids as best as we can. And just know that, we are one of those resources for you. Okay? That's all I got. Good luck.